Thank you so much for joining us, Doctor. I want to ask you about that new variant. Lots of confusion and consternation over whether it's more deadly. First, what do you make of the data? And then more importantly, perhaps, does it actually matter whether it's slightly more deadly in terms of our actual response?
Well, what I would say, so I'm speaking on behalf of the Doctors Association UK. What I would say is it's clear that the UK variant, shall we call it, is highly transmissible, and that's probably the most important thing. I think if you look at the nerve type report as I've done, it doesn't show any increased mortality for those that are hospitalized. Okay, so I think when we talk about vaccines and even the variants, I think it's really important that the medical profession talk about this rather than politicians. It really doesn't help the messaging.
So, as we heard, there's a backlash from some experts in the UK over the decision to delay the second dose for up to 3 months. Experts are weighing in on either side of the issue there. And as I said, we're having similar disagreements around the timing of that second shot here in the US. The CDC says it's okay if it's delayed. The FDA says it's not supported by science. Where do you stand on that debate? Vaccinate as many people as possible for the first shot, or vaccinate fewer but stay within the original parameters?
Well, the first thing I would say is vaccines are safe, and it's really important if people get a message to be vaccinated, go for it, okay? This debate is a medical debate about the timing of the second vaccine, particularly for the Pfizer vaccine, and that's important. And on the one hand, it's this debate about we're in a public health crisis, that should we delay it? But actually, I think, is there an opportunity for science to help solve this? Sheila Bird, eminent biostatistician, pointed out that, in effect, we're doing an uncontrolled population experimental study without pilot data. So shouldn't we randomize 25% of people to get it at 21 days and the rest delayed? And then we'll have the answer, and then we'll end this debate. But it's a real anxiety for huge numbers of our members, both on a consent issue, because obviously the drug was licensed at 21 days, so trying to explain it. So certainly my colleagues in primary care are very concerned about this. And even in secondary care, I've got colleagues who are very worried to the extent that some of them are shielding. And if they had both vaccines and therefore fully vaccinated, they'd be back at work.
But the bottom line, as you said, if you can get the vaccine, go get it. Now, there has been a big problem in convincing some people to get the vaccine, particularly people of color. Up to half of people in some areas with high ethnic minority populations there in the UK are refusing to get it. It's a huge problem here in the African American community as well. Is the government doing enough to address this, and what would you suggest be done to help?
No, I don't think they are. And even within Doctors Association, we've got members, often doctors who are working from overseas, who haven't got an NHS number, who are struggling to get a vaccine. But particularly because the BME community, the black community, have been hit so severely by COVID, it's really, really important there's targeted messaging, particularly for the at-risk groups. And the area I work in, Birmingham, has got some of the highest rates of COVID in the country. And we're seeing multi-generational families, often of ethnic origin, being admitted to intensive care in very, very stressful circumstances.
I guess if there's a positive note, there's the recent news in terms of cases has been largely good. I think we have a map of Europe and the US. A week ago, they were pretty much in the red, and now there's a lot more green, which means things have improved. Should we be encouraged by this, or as some health officials are warning, do these new variants mean we could see a totally different map again in a few weeks?
The new variants are a concern, but I'd highlight, in the UK, it was announced that over 4,000 patients are on a ventilator now because of COVID, and 10% of those are being transferred to other hospitals. That troubles me a lot. There's a real pressure on ICU beds. I'm a neurologist, a physician. I had to go to an operating theatre to see a patient because that's where the ventilator was last week.
All right. Well, we'll have to leave it there. Thank you so much for all of your insights. We appreciate it. Dr. David Nicholl in Birmingham, England. We appreciate it.